What is the sunken chest? The Pectus Excavatum is the depression of breastbone and is usually seen at the birth or a few years later of the patient. It's generally seen in the male patients. The male to female ratio is like 3:4:1. The breastbone depression majorly gives no complaints. But if the patient have complaints, the pain, palpitation, and exertional dyspnea, shortness of breath, might happen. How do we diagnose the sunken chest, the Pectus Excavatum? Most of the time, the family and the patient has complaints about the depressed breastbone, and it's usually seen from the birth. Sometimes the patient has symptoms, palpitations, exertional dyspnea, and chest pain. But radiologically, we use chest x-rays, the plain chest x-rays, and computerized tomography. If we think of other pathologies, we then use the EKG and echo for diagnosing any pathology of the heart. How do we treat the sunken chest, the Pectus Excavatum? We have surgical and non-surgical treatments. The surgical treatments are the modified ravage classical technique, which is done in open way. The other closed surgical techniques are the Noose Procedure, which we insert a metal bar under the breastbone. And the other one is the non-surgical technique is the vacuumbell surgery. We use it over the breastbone and for at least 1 or 2 years. How do we treat the sunken chest by a non-surgical treatment method? We call it vacuumbell method. The patient generally use it for at least 8 to 12 hours a day for 18 to 24 hours. If in this period, the compliance of the patient and the family is very, very important. If they can manage to use it for at least 2 years, the success rate at the end is like 80% for this technique. What are the open surgical techniques for treating sunken chest, the Pectus Excavatum? These are the modified classical ravage method and the Robicek method. In the ravage method, we use an open incision and we take out all the deformed cartilage out and then reshape the sternum in normal position and then suture the ribs to the sternum again. In the ravage method, we can put a metal strut under the sunken chest. But in the Robicek method, it's all the same, the technique, but we use a mesh putting it under the sunken chest. How do we treat the sunken chest, the Pectus Excavatum, using a closed technique? We call it the Noose Procedure. In this technique, we use the vast surgical instruments and we put a Lorentz bar under the sunken chest and under the breastbone, which protrudes the breastbone forward and corrects the position. After 3 years, we take out the Lorentz bar using 30 minutes general anesthesia surgery. This technique has a success rate of like 95 to 99% for correcting the sunken chest.